We're going to talk about Chapter 12, Community Assessment and Evaluation. We're also going to go over Chapter 13 and 14. So community is defined as a locality-based entity composed of systems of formal organizations. So basically, there's formal organizations that make a system that helps reflect what the society needs. And from there spawn off informal groups and aggregates that are interdependent on each other for functioning. So, if you live in, and a community doesn't just have to be a neighborhood. So you can have a community of women who believe in the same thing, and it starts off with with a formal organization, and then sees off into informal groups. So a really good example of that would be the Leche League. They have a formal organization called the Leche League, and then it's a community of women that form off into groups to follow through with the formal goals, and they make these informal relationships, and they're interdependent on each other to work toward a collective need. Community practice setting is an insufficient reason for saying that practice is oriented toward a community client. When you're talking about the location of a practice that's in a community, the focus of the practice is not just the individual or the family. It's also the whole community. So that's really important to remember. Community-oriented practice is targeted to the community, and the greater good of the population is what's most important. And so change to the greater good of the population will, in turn, change for good for the community. So yes, we do take into the fact that people come in as individuals or groups of families, but that we have to address in terms of the greater good, right? So the idea behind vaccines, a lot of people who get sick with the measles are vaccinated with an MMR. The problem with these vaccines is that being vaccinated isn't necessarily going to prevent you from getting the disease. It will definitely help you fight the disease. But if everybody's vaccinated, then nobody can get the disease because nobody will have it. It's really weird. It's called herd immunity. So that's for the greater good. So when you start thinking in terms of individuality, that's when you have a breakdown in terms of community-oriented good. So is it bad to think of an individual? Absolutely not. But you have to balance and weigh the risk-benefit toward the community good when you're focusing on the community. So most changes are aimed at improving the community health as a whole. And the changes involve partnerships among community residents and health workers. So you're not just going to be doctors doing this or just nurses. You're going to partner with community residents and other health workers and other disciplines. So social workers, nutritionists, public health specialists, government agencies. Because the health of the community isn't just looking at numbers in terms of blood pressure, you're also thinking about the mental health and morale, the urban health. Do we have enough places for people to live? The poverty health. How many people are living below the poverty line in this community? So it's not just having to do with someone's physical health. So assessing community health requires gathering existing data, generating missing data, and interpreting the data. 5 methods of collecting data useful to a nurse is informant interviews, so talking face-to-face with people within the community, participant observation, so someone observing, secondary analysis of existing data, so you're taking a database and looking from it on an observation standpoint, surveys, and windshield surveys. So it's really important when you're doing a assessment of a community that there is some entrance or acceptance or trust so that you can get true numbers. It's called the Hawthorne effect. People tend to say that they feel better or things are going fine in order to they feel very protective of their community. So it's really important that you have this trust so that people can be honest. A community health worker, like a nurse or a doctor, can be considered an outsider, and they represent an established healthcare system. So training those within the community to be able to help you collect data is going to help build a trust level. The planning phase includes analyzing and establishing priorities among community health problems already identified. Then you would establish goals and objectives, and what interventions can you accomplish, and what realistic interventions can you accomplish. It's really easy to identify and establish goals. So great, we have a really bad obesity issue in this neighborhood, and we want to lower the secondary complications of obesity by 2025. What are some realistic, identifiable interventions? Well, saying everybody's going to eat healthy might not work when you live in a neighborhood and the nearest grocery store is 5 miles away. Is that really an identifiable intervention? Probably not. Maybe let's build a community garden where everybody who volunteers in it can get X amount of boxes of vegetables every month. That's probably more realistic. So goals are generally a broad statement of desired outcomes. The more precise you get into these desired outcomes, the harder it is to achieve just in the beginning phases of planning, because sometimes they're just so specific that you're not going to reach it unless chances are if you're reaching a goal, it's so specific, or it's going to be smaller unless you have something more general. So let's talk about case management, chapter 13. So a really big role in nursing is, especially community health, is being a client advocate. I have case managed before, and it's really hard because you tend to straddle lots of roles in terms of being a nurse and also part social worker, which can be somewhat frustrating when you're getting into an area that you are not familiar with. So as a caseworker for a nurse, your main areas of focus are care management and client advocacy. The case management that a social worker does is quite different, and it's really important that you have your roles identified if you go into case management, just so that you don't get stuck doing something that you were never trained to do. Now, if they say to you, we want you to take up more of a social worker role in addition to your normal nursing duties, and we'll train you to do so, that's great. But sometimes when they throw you in saying, also start, estate planning with a family member, or helping someone get custody of their child, that's kind of out of a nursing wheelhouse. Okay, so when they're talking about case management, we're talking about the goal of advocacy to promote client self-determination, their ability to make decisions for themselves. So when you're in an advocacy role, there's lots of conflicts that can come up regarding full disclosure of information. You want to be able to fight for your patient, but you also have to be able to protect their privacy. Also, accountability to multiple parties. You're accountable to the patient, you're also accountable to who you work for. There's legal challenges to clients' decisions, and then also lots of competition for scarce resources, especially when you're case managing. So the functions of advocacy and allocation can pose dilemmas in practice. Case management is like one of the highest in demand areas in nursing. The turnover is really high because it can get really hard because there's just scarce resources. So skills important in fulfilling the role of client advocate include, having a helping relationship, assertiveness, and problem solving. Now, assertiveness doesn't mean being rude, but definitely being able to stand up for your patient and not being scared to say, I'm going to fight for this scarce resource. And then problem solving, knowing that most likely what the patient needs they can't get. So how can we solve this problem in a different way? So problem solving is a systematic approach that includes understanding the values of each party and generating alternative solutions. Alternative solutions that are just as good as the original solution. During a conflict, it's really important that you're able to move conflicting parties toward an outcome. So brainstorming together is really, really important. Continuity of care is the goal of community health nursing. It requires making links with services to improve the client health status. So understanding, okay, someone's getting discharged from the hospital and they're going into skilled nursing. We want to ensure continuity of care, so let's hook them up with a home health or with a nursing home that has good relationships with the doctors that took care of them in the hospital. And let's make sure that their primary care provider within the community has privileges at that nursing home. So you want to make sure that there's adequate continuity of care. It's an interdisciplinary process, so you should never be alone in your case management. You should always have the help of a social worker and perhaps another discipline. It's really a systematic approach of assessment, planning, service coordination, and referral, and then monitoring the evaluation of the patient's needs as they go through. So, does this person still need skilled nursing? Can the person move home with home health? What's the most realistic view? Sometimes, people have more resources just based on family. They have family